Yes, we have to move your nipple during a breast lift. And depending on how much drooping of your breast that we have, there's multiple ways to achieve this. So let's get into why your breasts droop and the 3 main ways that we achieve a lifted look in a breast lift. So why did your breast begin to sag in the first place? Well, there's a lot of reasons for that. For starters, there's the ever-crushing weight of gravity combined with that one time that you maybe gained 25 to 30 pounds stretching the skin, but then you lost it only to then get pregnant and then breastfeed your new baby, which then once again caused your breast to swell, and then you stopped breastfeeding so the tissue shrank, leaving your breast deflated and sagging. Or perhaps the suspensory ligaments in your breast stretched with time, and along with the aging process that we all go through, your breast tissue became lax and your skin thinned, so that led to the drooping. Either way, there are a lot of things that causes a woman's breast to sag. A breast lift is a surgical procedure that takes sagging or drooping breasts and places them back higher on the chest, giving a more youthful look. So then who is a good candidate for a breast lift? Well, the ideal candidate for a breast lift is in good overall health and is a non-smoker. Recovering from surgery will put a strain on your system, so the best shape you can be in before surgery will make your recovery that much easier. Then who's not a good candidate for a breast lift? Patients that are in poor health with multiple medical issues and active smokers will make a patient a poor candidate for a breast lift. Vaping and cigarette smoking will increase the risk of wound breakdown as well as increase the risk of losing a nipple during the surgery. Okay, we've determined that you're a good candidate for your breast lift. Now we have to decide what type of breast lift you need, and that's typically determined by how far the nipple sits below the inframammary fold. That fold just underneath the breast there, that's called the inframammary fold. There are 3 basic classifications for breast ptosis, and that is just the term ptosis is the term that we use for how far the breast is drooping. So grade 1 ptosis is where the nipple sits even at the level of the inframammary fold. Grade 2 ptosis has the nipple sitting about 1 to 2 centimeters below the inframammary fold, but still sits above the remaining breast tissue at the bottom of the breast. Grade 3 ptosis is where the nipple and areola are below the inframammary fold and sits at the very bottom of the breast. So imagine the nipple pointing straight at the floor. That is grade 3. If you just need your nipple and areola lifted just a couple of centimeters, then a peri-areolar breast lift might be right for you. I tend to reserve this approach for patients that have wider areolas and want to see the diameter shrunken down a little bit. It also tends to be better for patients that have grade 1 ptosis who don't have a very wide breast and want to see a slight lift in the breast shape. It's great for these reasons as the scar around the areola blends in very well and it's easier to hide. It also doesn't leave scars on the other parts of the breast, so that's another benefit. Another thing that's beneficial in some patients is that it can also deproject the breast, helping to round out the breast from a more cone-shaped breast appearance that some women can have. The downside of this type of lift is that we can only move the nipple so much because we aren't really getting rid of a lot of excess skin in the breast. Typically about 1 to 2 centimeters on average is how far we can raise that nipple up. The next type of lift that works well for grade 1 ptosis patients is the vertical breast lift, or the lollipop lift. It gets this name because the scar tends to wrap around the areola and then involve an incision down the center of each breast looking like a lollipop. In some cases, the scar can be hooked in a J shape down to the fold to help get rid of some excess skin and help tighten the breast up as well. I like to use this lift for patients that don't have a long distance between the nipple and the inframammary fold, but just have a little extra width that needs to be removed to get that shape that they are after. The great thing about this type of lift is that we can use some of that breast tissue and tuck it up high underneath the nipple area to give you a slight augmentation using your own breast tissue. This option is great for anyone that may not want breast implants with their lift. Typically, this lift is for patients with grade 1 ptosis, as any further descent below the inframammary fold will require a larger lift and resection of more excess skin. Which leads us to the majority of people who want a lift. Patients with a grade 2 or 3 breast ptosis will typically require an anchor incision breast lift. This lift removes the most amount of excess skin and allows us to move the nipple the longest distance out of all the breast lifts that we just discussed. This lift involves an incision around the areola, which then heads down the middle inferior pole of the breast and then along the inframammary fold. At this point, you're probably saying, hold up, that sounds like a lot of scars. And in a way, you're correct. While this type of lift does have a lot of scars, only a small portion of the scars become visible to people in the long run. After a breast lift, the breast sits high up on the chest, and as time goes by, it will descend into a more natural position again. This in turn tends to block the view of the scar running along the inframammary fold. In the end, the only scars that may be visible are the vertical scar, possibly the scar around the areola, depending on how well you heal. The other thing is that the scar along the inframammary fold doesn't have to run the full length of the fold. Some people will require the full length, others won't. So scar lengths can vary from person to person. In the end, a breast breast lift will move the nipple higher up onto the chest, giving you a more youthful look and shape to the breast. But here's the one thing it won't do. It won't give you a lot of extra fullness in the upper pole of the breast. To achieve that, we need to place breast implants, and you can learn all about that in this video right here. I'm Dr. Paul Pearce. I hope you learned something today. We'll see you in the next video.